Hey guys, welcome to today. So today's video is going to be about informing you on a few things that we've been dealing with and going through over, I guess, the past couple of weeks.
Yeah,
in between ultrasound, sort of updating with a couple of things that we've discovered, I guess you could say.
Yeah, so as you guys know, so far this pregnancy hasn't been easy. It wasn't easy to get pregnant, and it isn't easy to be pregnant. Not necessarily because of symptoms or anything, like I haven't had anything too crazy, whereas I know some people get a lot of nausea and the first trimester is really hard because of those reasons, but we have like a different set of stuff. There have been just some things coming up that honestly we had no idea about, never thought about once in our life, and never felt that we needed to worry about it because we didn't know it existed, and then all of a sudden we are worried about it. But I wanted to put a disclaimer. We are still pregnant, everything is still okay. Baby is still okay.
Baby is measuring right on track. The baby is looking really great.
Yeah, and we just have a few hiccups, I guess.
Yeah, some things that I guess we have to make sure that we monitor, to say the least.
So the first one is something that you guys already know about. Is our SCH, our subchorionic hemorrhage or hematoma, and it's a bleed that's outside of the gestational sac. So as for the SCH, we have done a few ultrasounds.
Ellie! Oh my gosh! Stop, we're filming a video!
A serious video. Okay, so as for the SCH, we have done a few ultrasounds to monitor it since we first found out that it was there when we went to the ER one time. So each time we have gone, it has unfortunately grown by just a little bit. So the last time we went, it was considered sizable, I guess. And so it's no longer small, it's, you know, I don't know, he didn't really say large, but he said it's definitely there.
He said it's alarming.
Alarming, yeah, which isn't a nice word to hear.
No, you never want to hear that word.
So we were a little, you know, we've been worried about that, obviously, but I know that it is fairly common. A lot of IVF pregnancies might have this, especially frozen transfers for some reason.
Yeah, apparently it's way more common, and our doctor even said that they see it in 25% of patients.
And also that it usually reabsorbs and is not a problem, usually after the first trimester. But because it is still growing and because it is still there, we are going to keep monitoring it, and it does require, now that I am staying away from physical activity, that I am being very restful. My doctor has recommended that I do that for at least 6 weeks. Something that has been very heavily weighing on my heart is that I have decided to take some time off of work because of that, and so this is all part of the emotions because I didn't want to do that. But
so if you guys didn't know, Ayla's been off for the summer as she's a preschool teacher, and 2 weeks from now is when she's supposed to be going back.
Yeah, so terrible
basically
timing.
Yeah, the first 4 weeks that she would have been working are a part of the 6 weeks the doctor said you need to take it easy, and so he's basically recommended not going to work.
Yeah, so we have that figured out, hence why I didn't want to make this video before figuring that out with like my job and stuff, because that wouldn't be good. So that's one thing that's tough. But yeah, so that's one thing. And then the other thing was something that was really surprising, honestly.
Yeah, this is something that we wish they had said or noticed earlier on in some of our ultrasounds, but somehow wasn't really discussed or looked into until we actually brought it up ourselves.
And the reason we brought it up is because we had a couple comments from you guys asking like if the doctor said anything about it based on the picture of our ultrasound.
Yeah.
And the first comment, like, you know, like YouTube, like people just comment stuff. So the first time they said something, I was like, oh no, like it's fine. And then the second time I was like, I'm gonna Google it. I'm really scared now. And I did.
As most of you know, you end up getting really terrible results when you Google things a lot of the time, because you get the opposite ends of the spectrum of what it could be and what the cause of it and what the result could be. So Ayla did that, and it wasn't promising.
We didn't even say what it was though. So the ultrasound has the baby, the yolk sac, and the gestational sac, and our yolk sac is bigger than it is supposed to be. And think, like
Yeah.
quite a lot bigger.
Like twice the size of
size.
what they say should be the max size.
Yeah, so I didn't know what the size was. I was just basing it off of just eyeballing it, but I felt in my heart that it wasn't good after researching and stuff. And so from our understanding, like we're not doctors, but our understanding is that what has been commonly seen, there's no studies really or anything, but what has been seen is that people, when they have a large yolk sac, they tend to miscarry. And that scared the living daylights out of me, obviously, and I was really worried. What I understand about it is that the yolk sac is providing nutrients to the baby, and so if the yolk sac is getting bigger, it's because the nutrients aren't coming from the yolk sac to the baby, and so the yolk sac would be getting bigger and the baby wouldn't be growing, and that's when that's a big problem. So our ultrasound, of course, showed that everything was fine with the baby.
Yeah, this is like going into Wednesday this past week, we were worried because we knew, okay, it's a large yolk sac, but we didn't know if it had changed since the last scan, which would have been 2 weeks before. And so we were going into it pretty nervous, but almost immediately at that scan, she went right to looking for the heartbeat, and it was like
first.
right off the charts, perfect. Like 176, I think is what it averaged to. And we were just like so happy to hear that right away, and we're glad that she showed us that, because I mean that, you know, put us at ease.
Yeah.
And then it was measuring things, and of course it did grow from the last time, and it is big, but the baby was the most important thing, and that is that it was the right size. It was on track, which meant that there wasn't nutrients not going to the baby.
Yeah.
And as much as the yolk sac was big, it wasn't creating an issue there.
Yeah.
And
at this point in the pregnancy, the placenta is already forming and it's starting to take over.
Yeah.
So the yolk sac is kind of like old news.
It's supposed to also reabsorb back into the body at some point.
So that was the first hurdle that we were worried about. And so we left the ultrasound and we went about our day, and then we did get a call later that evening from our fertility doctor, and he just explained everything to us. You know, said that this isn't normal, of course, that this is something that we need to pay attention to, but he feels that because the baby is growing perfectly and the heartbeat is good, that we shouldn't be worried about a miscarriage.
And he's not even really worried about the yolk sac at this point.
Yeah, the thing is with the yolk sac though is that it can be indicative of a slightly higher risk of chromosomal abnormalities. So I think he said, the conversation had so much information, so I think he said we're at 2% risk.
Whereas most people would have been at a lower risk, we're at about 2%, which is still
isn't
very
high.
low, and not something to like completely lose our minds over.
But this is just based on little information.
Yeah.
So we are going to be actually referred to a high-risk OB for a consultation. I've already started to try and get the works on that, and we'll do some more testing and stuff there and hopefully get a better idea. But that's the grunt of what we're dealing with right now.
Yeah.
I mean, it's so confusing. It literally confused me for days. I didn't know how to feel. I felt like, okay, this like terrible thing like that could take my baby away and could cause all these issues, but then I'm like, but he said he's not worried about it. So I feel like I should take that as a good thing, and like I should be happy about this phone call, but I felt still really conflicted. Like, you don't want to hear that anything's potentially wrong at all.
No, you don't. And I think one reassuring thing, and maybe you remember, I don't remember exactly how he said it, but he had visited some colleagues at a conference and they had done a study. And do you remember? Essentially,
the understanding is that the size of the SCH doesn't necessarily correlate with the result of the pregnancy. Meaning a bigger SCH might not mean, like, just because your SCH is bigger doesn't mean you're more at risk to have an ended pregnancy. But again, we don't know. So we're just telling what we've been told.
That did make us feel better, and then also the fact that he doesn't really see the yolk sac in its current state as an issue. did kind of make us feel a little bit better too.
So we're gonna do the testing that they tell us to do. We're just gonna go with the flow because we're no experts, we don't know.
Yeah, we'll just take it a day at a time, and we'll go to these appointments when we can, and depending on when we get scheduled. But right now we're just waiting.
Yeah, it's tough because like I don't want to be a high risk pregnancy. I never wanted that for myself, and
yeah.
I don't know what it means going forward. Like, you know, with my midwife, am I gonna have to switch? Like, I don't know all of that. There's a lot of unknowns right now that I think is the scariest part. But all we can take is that baby is growing as far as we know. Baby is healthy.
Yep.
And
that heartbeat is just beating away, and we heard that heartbeat.
Yeah.
And so right now the baby is looking really good, and we're very happy about that.
Yeah. So if you wouldn't mind, keep us in your thoughts. These next few weeks I think are gonna be a little harder on us because of
everything gets a little bit
high risk.
Everything's scary for sure.
It's hard, like when you're trying to get pregnant, it's so hard, but when you're pregnant, it's like you're so afraid to lose what you have, like because you know how good it is, that it's almost like you've already, like, you know what I mean, tasted the
you've
goodness.
Also, like, the journey to get to being pregnant is also so hard, and that's long, and so you know how much work it takes to get there, that you don't want that to, you know, start over. So.
And so it's just been crazy, but we're okay.
We've had a lot of things we've had to go through so far in these short 10 weeks, but we're hopeful for what's to come, and we're looking forward to meeting with the high-risk OB.
So keep us in your thoughts, and we'll see you and talk to you soon.
Thanks, guys. Thanks for watching.
Bye.
We'll see you for now. We'll see you later.
Bye, guys.
Here's what I found on the web for what's the fruit apple.
Siri, nobody asked you.
Okay, bye.